Hello and welcome to day 11 of 30 Days to Better Hearing. Today we are going to be talking earwax. Now, earwax is perfectly normal. It's just your body's way of getting rid of dead skin in your ears. We all have it, and most of the time it comes out by itself in really small amounts. When you wear hearing aids, you'll find sometimes pieces of earwax when you take them out. Maybe you already have. And sometimes you can find that earwax builds up a bit more in your ears when you're wearing hearing aids. This is because when you're pushing something into your ear, the earwax that is on its way out inadvertently gets pushed back down the ear again. Now, it's important to be aware of this, and if you're suspecting a bit of earwax buildup, for example, if the hearing aids are whistling a bit or maybe they aren't as clear, get an appointment with your audiology clinic and get it checked out. For some patients, we have to have a routine which includes earwax removal alongside hearing aids. For others, they're able to manage it themselves. It's not just about having clean ears, it's also about ensuring your hearing aids are working effectively. Earwax can significantly impact the functionality of your hearing devices, from reducing their volume to causing uncomfortable feedback noises. So keeping an eye on this is crucial for maintaining optimal hearing aid performance. But managing earwax doesn't have to be a hassle. For starters, daily wiping of your hearing aids with a clean, dry cloth can remove any wax that's built up on the devices themselves. Many hearing aids come with a tool designed specifically for cleaning, which can help you gently remove any wax from nooks and crannies without damaging your hearing aids. If they do get blocked up, you may have to change the wax filter, which is usually quite a simple task, which we'll talk about soon. Additionally, practicing good ear hygiene can manage earwax buildup. However, it's important to avoid cotton buds or inserting any objects into your ear canal, as this can push the earwax back in, leading to impaction. Instead, consider using over-the-counter drops like sodium bicarbonate or just olive oil drops. I would do this before you go to bed though, as you don't want to get any in the hearing aids themselves. As I mentioned, if you find that earwax is a recurrent issue for you, it might be worth discussing more regular professional cleaning options with your audiologist. They can provide safe, effective earwax removal services that ensure your ear canals are clear and your hearing aids can function at their best. Remember, earwax is a normal part of ear health, and a little bit of maintenance can go a long way in ensuring your hearing aids provide the best possible support for your hearing. By staying vigilant and adopting a few simple care routines, you can keep earwax in check and continue to enjoy the full benefits of your hearing devices. That's all for today's session on earwax and hearing aid maintenance. Join me tomorrow for day 12, where we dive into another important aspect of hearing aid care. See you then.